My name is Rodney Burrow. I am a surgical oncologist in urology and an associate scientist in epidemiology at the Ottawa Hospital and the University of Ottawa. The paper that we are going to be publishing in the upcoming edition of Mayo Clinic Proceedings is reducing the harm of prostate cancer screening by repeating an abnormal PSA test. So in this study, we evaluated over 1,200 consecutive patients who were referred to our center with an abnormal PSA test. And what we found was that just by repeating that abnormal PSA test, many patients are found to actually have no abnormality. So 25% of our patients have a normal PSA test when it is repeated. And many of those patients are able to avoid an unnecessary prostate biopsy when that happens. Furthermore, if the repeat PSA is normal and they do end up still receiving a prostate biopsy within the year, the risk of having prostate cancer is significantly reduced from those who have an abnormal repeat PSA. In a man who has an abnormally elevated PSA test, that's from prostate cancer screening, that test should be repeated prior to a decision about whether to proceed with a prostate biopsy or not. In areas where repeating an abnormal PSA is not standard of care, this could have a significant impact for patients because many men will be screened for prostate cancer and many will be found to have an abnormal test on that screening. So the potential impact of adopting this practice would be significant. So prostate cancer is a very common malignancy. 3% of all men will in fact die from prostate cancer. So prostate cancer screening makes a lot of sense to most physicians. That being said, prostate cancer screening is quite controversial because while there are some benefits to screening, there's also significant potential harm associated with screening. So a big part of our work is trying to reduce the harm of prostate cancer screening while maintaining those benefits. In this study, we found one method to reduce the harm associated with prostate cancer screening, and our future work will continue to proceed to try and improve outcomes for these patients. Well, prostate cancer is a very common malignancy for men, and unfortunately 3% of men will die from metastatic prostate cancer. So prostate cancer screening makes a lot of sense to most clinicians so that the disease can be detected at an earlier stage and treated at that stage. But prostate cancer screening is quite controversial, and while prostate cancer screening is beneficial, there are also downsides to prostate cancer screening associated with false positive PSA tests, overdiagnosis, and sometimes overtreatment. And part of our research program is to try and maintain the benefits of screening while reducing some of the potential harms. So the reason we did this study is we felt that simply by repeating abnormal PSA tests, we could reduce many of the potential risks that patients encounter and improve the safety of screening in general. If you do have an abnormal PSA test, there's a good chance that that could be a false positive. And with a fairly inexpensive repeat of that same test, a man may be able to avoid unnecessary biopsies that have the potential risks and inconvenience and costs associated with it. So prostate biopsies in general are fairly safe, but there are some potential side effects, especially infections that can occur after a biopsy. It's inconvenient and can be uncomfortable for patients. So we certainly want to biopsy people who need a biopsy, who have prostate cancer, but we want to avoid doing unnecessary biopsies in patients who do not have cancer. And through this study, we've shown a pretty easy method to reduce the number of unnecessary biopsies that are performed.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.